Hello, I'm Dr. Maurie Markman from City of Hope, and I'd like to discuss a very interesting and somewhat sobering topic, and that is survivor views on medical debt in the cancer arena. What I'm describing here is survey results from the American Cancer Society Clinical Action Network. This organization did a survey that included 1,284 cancer patients and survivors nationwide who had been diagnosed with and treated with cancer over the last 7 years. The survey was conducted between March 18th and April 14th, 2024. There's been a lot of discussion, of course, about the rising costs of cancer care, but I think it's really to hear the data from the cancer patients themselves is both important and, as I said, sobering. So what was learned here is nearly half of the cancer patients and their survivors, actually the number was 47%, had medical debt related to their cancer. And of that group, about half had carried over $5,000 in medical debt. 69% had carried this debt for over a year, and a third had had this debt related to cancer for more than 3 years. Very importantly, 98% of the people in this survey actually had medical insurance. So we're not talking about individuals with no care. So this is a population that one would say, if anybody should be okay, this group should be okay because they have insurance. The health implications of this are really disturbing. As noted in the survey, this cancer-related medical debt, more than 3 times the individuals who had debt were behind on cancer-related screenings compared to those who did not have debt. It was 18% versus 5%. 27% of those with medical debt had gone without adequate food. I'll say that again. 1/4 of those with cancer-related medical debt had gone without adequate food, and 25% had skipped or delayed care. And if one asked about the direct financial consequences related to the medical debt, nearly half saw their credit scores deteriorate, and 30% had difficulty qualifying for loans. The numbers speak for themselves. Our goal is to treat and where we can, cure cancer. We can't cure to extend survival, and if we can't extend survival to a large extent, improve the quality of the life of patients. And yet we see here in this survey, again, more than 1,000 patients, this is in a small group, the impact, cost of treatment, and the method of payment is having on our patients and their families. Is this acceptable? I would argue something is wrong. Again, very interesting data from the American Cancer Society. I'm sure there'll be more surveys coming along in the future. On the basis of the way things are going, I suspect the data will only look more disturbing. I thank you for your attention and encourage all of you to think with all of us how we're going to overcome this problem. Again, our therapies are becoming more effective. The impact on the quality of life as it relates to the treatment is becoming superior. But the impact on medical debt is having an incredibly negative impact on our patients and their families. What's to be done about it?